This is the current status of where we are in America today. When I say these things to people back in Dallas, Texas, I receive a lot of feedback, and one of them is that I have selected comes from a man who is self-employed. He falls under the what might be off exchange, meaning he pays for his own health care without it being on a pre-tax basis, and he said, I am being penalized for being an entrepreneur. Penalized. This is true of the 20% that are in Medicaid. They are in a system that essentially keeps them there and keeps them from going to gain the opportunity to receive full-time employment, because it might not be an employment that provides health care. So Republicans have a daunting challenge. We have a challenge to understand that there are about 12 to 20 million people who presently are on Obamacare, including members of Congress. And it is a very expensive, not only to the country, but also to individuals, insurance plan. The biggest problem with Obamacare is not its expense. The problem is that people are not on the system as we were told it would happen. We were told there would be upwards of 40 million people, providing an opportunity for more people to pay into the system, to sustain the system, and for it to be what I would say structured in such a way to where it had young people, middle-aged people, and perhaps up to older people up to Medicare age who would be paying in or be a part of a system, and it didn't work that way. Younger people are not in Obamacare because it's tremendously expensive, and they have found that to meet their deductible, it takes thousands and thousands of dollars. It does not meet their needs. It does not meet my needs with my family. It would not be a preferred health care choice that I or my family would make. So we now have a choice, a chance, as a result of the American people saying, okay, Republicans, let's see what you can do. Bring us your ideas to make health care better. Here's one of the facts that we know. We know that of the family working status of uninsured, 74% of people who are uninsured go to work. Now, this is a staggering fact because we were told by President Obama and Democrats that they were going to make sure that people got health care. The working poor, as we were told, people who needed coverage. But in fact, 74% of 30 million people get up and go to work. What we find is that they have lost many times their full-time status because of Obamacare rules and regulations, mandates on employers to where employers cut their full-time status to part-time workers. And because we have so many part-time workers, they cannot afford to get the payments that are necessary, even though they are above the Medicaid line. So Republicans now have a choice to be able to say, if we're going to outthink Obamacare, if we're going to make sure that we believe, as President Trump has said just in the last few weeks and on the trail as he was running, he believes we should have a system that is not rigged. We should have a system that helps cover every single American and creates an opportunity that is sustainable and does not mean that we have 60% or even double-digit increases every year in health care because of the inequities that exist in the system.